If you're dealing with foot drop, you might be wondering, is it coming from your back or from nerve compression in your leg? These are two of the most common causes, but the treatment depends entirely on finding the real source of the problem. In fact, we recently had a client who had back surgery for foot drop and it didn't work because no one looked at the whole story. In this video, we're going to show you how to tell the difference and what to do in each scenario. So let's define what a foot drop is. A foot drop is when you can't pull your toes up. So when you walk, your toes are pointed down and you have to lift your leg up pretty high in order to walk. It's not fun, and you definitely want to make sure that you get this resolved very quickly. But what are some of the two areas that can create foot drop? And this is what is often missed in the medical community because they're like, oh, it has to be the back, but there's really two areas that can create foot drop. And it's really, I wouldn't say it's easy to tell the difference, but that's what we're going to kind of go through. The first area is the back. Most common cause of foot drop is the back. And so if you're having a lot of back pain and you have foot drop and we see you and you can't move very well, we're thinking more than likely it's probably coming from the back. But if you have no back, like you have back stiffness, but you really don't have that much back pain, you can really move pretty freely without any issues, you're thinking, it must be the second source that can create foot drop, which is the deep peroneal nerve. And the deep peroneal nerve comes through the front part of this anterior tib, the front part of this muscle. It gets stuck right up at top, right in through there. And when it gets compressed through there, it can create foot drop because you can't actually pull those toes up. But it presents, again, very differently than from your back. When you have someone that has more deep peroneal nerve compression, what you're going to notice is their foot will turn in. So their foot may go in a little bit more because they can get a little bit of dorsiflexion through the muscles on the inside of the leg because those actually operate and they work just fine. That's not the nerve that's being compressed. That's one indication of us looking at like how they walk, because if they have nerve compression from that deep peroneal nerve, their foot may be turned in just slightly more. They can kind of move it, but they're getting most of the movement. If you tell them, like, where do you feel it? They'll say they feel it on the inside of their leg. When you have regular foot drop, like from the back, you don't notice those things, and they have a hard time pulling anything up. And so you've got to distinguish between the two. The big thing is, I'm going to kind of share a client story so you can kind of understand like how we put the pieces of the puzzle together. We had a client that came in, and this is not the first client that we've seen like this. We've seen multiple clients that were like this, but this particular client came to us after he had back surgery. And so the biggest things that we were wanting to know is the foot drop really coming from the back? We need to know how quickly did they have the surgery from the time that you had that foot drop. The reason why that's important is because you want to get the pressure off that nerve as quickly as possible, because the longer you have it, the more damage the nerve. The nerve is the slowest healing part of the body. And you want to get the pressure off that, because if you damage it enough, you won't get it back, which is why when you have foot drop, it's important to go, okay, we've got to act quick. I mean, the doctor wanted to do surgery immediately. And so we never saw this client before having the surgery. If we would have seen the client before having the surgery, we probably would have checked in other areas, because I bet he's had a history of back pain. He's had a history of having back surgery. So of course they wanted to go in and do back surgery, but we've had other clients that were very similar to that, where they had back surgery in the past and now they have this foot drop. But when we asked him how he injured himself, he said he basically fell, he slipped, and his foot got caught in basically plantar flexion, where their foot is pointed forward, and he landed backwards on it. So when you do something like that, where your foot and you're landing backwards on your foot like this and you go back, you're eccentrically loading the front part of this leg. And when you eccentrically load that, you create damage. So his history of like just taking his story of how he got injured gets us like, we need to make sure and really rule out if the back is an issue or if it's really coming from down here, because that's what he stretched and loaded it at the same time. And that's how you do a lot of damage with injuries. And so that him telling us that already gave us a ding, 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 ding that, okay, we need to figure this out. Like, I don't think it's actually coming from his back. The other indication was he had the foot drop after that injury and he had the back surgery within like 2 to 3 weeks. That's pretty quickly. By, 2 weeks, 3 weeks working on some of the strengthening stuff, he should be able to walk without that walker, but he couldn't. He still had pretty massive foot drop and no one was ever really addressing that. So he called our office because he had been here before and was like, I want to do shockwave. I'm like, well, it just depends on like where it's coming from, because I'm not going to shockwave something down below if the injury is actually in the back, because if the nerve damage is in the back, you're going to do shockwave there. But if the nerve damage is down lower, we can do shockwave there. We just need to figure this out. And so because he was having all these problems, he had back surgery and the foot drop did not change at all. And with the way he had his injury, we're thinking probably down and through here. And I mean, as soon as we touched through here, he just about jumped off the table. And I'm like, yep, that is where it gets stuck. That is where you get impinged on that deep peroneal nerve. And that when you do that, that's what causes foot drop. So we ended up doing we ended up doing shockwave on him in that area to progress things a lot faster, not only help the nerve heal faster, but get the tissues and the scarring, everything that had happened, get that away, because this has been going on since June. So we're looking at 3 months of having foot drop with no relief to that nerve because it's coming from the wrong area. So that's really how you notice the difference. Because if you have foot drop from back pain and your back, you're going to have that much of a reaction to a pinched nerve that's giving you foot drop, that much pressure on that nerve, you are going to have back pain. And if you don't have that much back pain and you don't really have that much, maybe a little bit of back stiffness, we can go and do some mobilizations to figure out if that's where it's coming from, and rule it out or rule it in pretty quickly, because you're going to be pretty sensitive if you have that much of an injury to your foot coming from your back. So that's a big telltale difference. The other difference is looking at the scenarios, how they injured it can give us some good indications. If we've ruled out the back, the only other spot is down through here. You can feel the tenderness. If they're super tender, again, that starts giving us indications that it's going to be a little bit lower. So that's kind of how we tell the difference. A lot of it comes from the stories and from our evaluation process. And so what do we do with this? So if it really is coming from the back, it's coming from the back, and what happens is we have these discs, and the disc can basically bulge. And when it bulges, it hits these nerves through here. And when you pinch a nerve low enough, that's in the lower levels of your back, you pinch it enough, there's enough damage, there's reduced signals going to your leg, it's going to produce a foot drop where you can't do it. But I'm telling you, this is a pretty serious condition, and if we can't get people back where their foot gets strengthening back pretty quickly within like a visit, we're often saying like, yes, you need to go and have surgery to get the pressure off of it. But a lot of times we can take the pressure off of it, because if it's bulging in the back and everything is intact with that disc, then all we have to do is push on the other end. So if we go and we're bending forward, that's what moves everything to the back, which is where the nerves are. We want to reverse that direction. So you're just going to start out really small, doing stuff on your stomach. You can start out with just hanging out on your elbows and just kind of seeing if you notice that like you're getting pain down your leg and now it's moving up your leg. These are all good indications. You're going to definitely want to test your motion before and after. So, how much can you pull the foot up? Can you even pull anything at all? And so use these as baselines, use your range of motion as baselines, and start working towards reversing it, seeing if we can take some of the pressure off. Now, sometimes a herniation is so big, you're going to have to put pillows underneath your stomach so that it actually kind of opens up that space. And what happens is we open up the space in the back when we put pillows. We're in a little bit of a flexion, but gravity is going to hit it. And gravity is going to slowly move because you're in this direction and gravity is kind of hitting us. So if we go in and we put, like, I don't have a pillow, but I'll grab this. If I go in and I lie over this to be in a little bit more of a flexed position in through here, I can hang out here for a while. And if that takes away my leg pain, that's great, because again, you are in a slight flex position, but you're going to allow gravity to slowly bring the material in that disc down. So you're going to hang out here for a long period of time. So if you notice that, like, every time you try to extend, you're getting pain in the leg, it's making it worse, you're probably going to have to start out something like this to get some of the pressure off that nerve. We have had people that had 9 and 10 millimeter herniated discs that we've been able to help get their life back and avoid the surgery. And this is the first thing that we have them do. So you may have to start out here before we can even start reversing that direction. And you'll have to do this a lot, and it's going to be very, very slow. But again, you're looking at trying to take the pressure off the nerve so that you can get that dorsiflexion to kind of come back. If you have issues and this is a problem, I would say you need to get to someone that really knows what they're doing so that they can get that assessment done as quickly as possible, help you move through the stages faster to feeling good, or get you to surgery. Because again, the nerve is the slowest healing part of the body. And if you damage the nerve, the nerve's attached to our muscles, which allows our muscles to move. And so if you don't have that, you will always have foot drop, which is not a good thing. Now, the deep peroneal nerve is in through here. And so what we do with this, a lot of times we've done it where we've just like really dug in to break up the scar tissue and break up the scar tissue and break up the scar tissue. That works. We've done it with clients before and they did a fantastic job and they got back fully. Shockwave will actually get us there faster. And so that's what we did with this one client, is we did shockwave all in through here. His ankle was super stiff as well. So we went and did some stuff with shockwave into that ankle joint to like make it the ability for it to move a little bit better. And then you start working on strengthening. Easiest way to start strengthening is bringing the leg way far out. So you can even sit in a chair, and if you bring the leg far out, you're going to try to pull those toes up as far as you can go and then coming back down. The more that it's underneath you like this, the more that gravity is going to, it's going to be harder, and it's going to take gravity. You're going to go up against gravity a little bit more. When your foot's out here and you're pulling it in, you literally are just we're going to kind of with gravity. So it makes it a little bit easier so that we can try to go through that full range of motion. So once we take the pressure off the nerve through here, we've got to work on getting that strength back and working on getting that muscle to fire. And then we start working our way down to where we're standing and doing the same thing, and then work on walking, different parts of walking to be able to pull those toes up, start working on some more strengthening stuff with it. But those are the beginning stages of what you can do. Now, the biggest key here is the evaluation is what matters. Getting to someone that understands this. This particular client should have never had back surgery. The foot drop was not coming from his back surgery, so it's very costly, takes a lot of your time and energy. Plus, I mean, who wants to have surgery if they don't have to, if you could have avoided it? And it really takes someone coming in and just critically thinking and listening to the story and putting the pieces of the puzzle together to really figure out what is going on. And I'm hoping this video is going to help you kind of understand your body a little bit better, or at least give you an idea of like, whoa, there's two main areas that can create foot drop, and we've got to figure out where is it coming from. And so the biggest indication again is if you have back pain, and it's a lot of back pain, more than likely your foot drop's coming from that. But if your back is not that bad and you're still getting foot drop, you're going to think of potentially going into that deep peroneal nerve and getting some of the tension to release in that area and start working on some strengthening. Foot drop can be scary, but the good news is once you know the true source, you can actually fix the problem. Whether it's coming from your back or nerve compression in your lower leg, the key is a proper evaluation. Let's not do guesswork on this. If you found this helpful, give this video a thumbs up and subscribe for more solutions to complex problems. And share this with someone who might be dealing with foot drop. If you want to learn how you could work with us, go into the description and click on the free discovery visit if you live in the DFW area.